to be with you. It's Peter Barwis here, cardiologist, and today what I wanted to talk about was all things cardiovascular risk factors. What they are, what can we do about them? When we're exploring cardiac risk factors, we're looking at a broad category of two major groups. One being the non-modifiable risk factors, and they are unfortunately things that we can't change or we can't do much about. And secondly are the modifiable ones, and that's really where the greatest impact can be had at reducing the risk of building up complications in the future. And what are these complications? Well, they can be many and varied. Development of heart disease can include things like angina, a syndrome where we develop chest pain and problems like that, but also heart attacks and preventing the risk of that, strokes, problems with our eyes and blindness as a result of poor blood flow to the arteries, but also kidney issues, blood flow problems to the feet and to the legs, where we develop a symptom called claudication when we're having difficulty walking with pain in the back of our legs as a result of a reduction of blood flow getting to those vital organs and vital muscles. This entity of cardiovascular disease results from a buildup of fatty deposits and plaque, or a process known as atherosclerosis. And this is a development of cholesterol that builds up in the wall of an artery that over time can progressively worsen, causing a reduction in blood flow, thereby symptoms. This process of atherosclerosis can also put us at a higher risk of developing blood clots within the artery. And all it takes is a little bit of a fragment of cholesterol to break off the wall of the artery, and therefore that exposes the underlying bits of plaque to all the cells circulating in our bloodstream, including those that are making us more prone to blood clotting, such as platelets. And that can have significant consequences. For example, if an artery were to block off in the heart, completely block off and starving the muscle of oxygen, then that is a medical emergency whereby we really need to go and open that artery up to restore blood flow, minimise damage to the heart muscle. So cardiovascular disease unfortunately continues to represent the leading cause of disability and unfortunately death in our community. And I think having an understanding of what these cardiovascular risk factors are helps us to better reduce our risk of developing them long term. So we talked about the non-modifiable ones, with age being one, and as we get older, unfortunately there is a higher incidence and risk of developing events. A male gender is also another risk factor. However, there is an increasing risk of cardiovascular events in females beyond the menopause years, but nonetheless, the male gender still represents a higher risk of developing cardiovascular episodes and events. And then we've got genetic factors, and there might be a family history of having had a heart attack or a stroke in the past. When we talk about a family history, here we focus on a cardiovascular episode that has occurred in a first-degree relative at a younger age, and that age is typically around 40 or 50. So having grandma that had a heart attack when she was 92 doesn't necessarily increase your risk on its own of developing a heart event, but again, having somebody that, say, in their 40s or 50s had a cardiac event certainly does increase the risk. And that genetic risk may also translate to a genetic risk of high cholesterol, because there are genetic factors that can make our cholesterol more vulnerable to be increased, and that can run in families. So I think if you are aware of a family history of heart disease occurring at a relatively younger age, then I think it's important that you have your risks assessed with your local doctor to ensure that we reduce these long term and we have a baseline understanding of where your cholesterol is at. So when we tackle cardiovascular risk factors, the key ones that we want to focus on are the modifiable ones. Now, by modifiable ones, I refer to blood pressure or high blood pressure. That's a key risk factor. Over time, causes a buildup of plaque in the arteries, but also causes thickening in our arteries. And that thickening can affect not only the arteries around the heart, but also to the brain, to our eyes, to our kidneys, and makes us more vulnerable to building up problems such as clots. So again, very important to look at optimizing blood pressure. Diabetes. So you might have heard of this condition. It's a condition whereby we have an excess amount of glucose circulating in our body, typically because of a reduction in the amount of insulin that our pancreas is producing. And insulin is a hormone that is released by our pancreas to go in and mop up glucose out of our bloodstream and store it in our vital organs. However, when the insulin levels are quite low, and when the pancreas has to work overtime in dealing with elevated levels of glucose in our body, then it becomes a challenge, and therefore we become more vulnerable to building up glucose in our body, and that can have significant consequences not only on the blood flow around our arteries, promoting the build-up of plaque or fatty deposits in them, but also have an impact on the kidneys, where it makes the kidneys more vulnerable to losing protein, and therefore can have long-term consequences on kidney function. So I've talked about high blood pressure, diabetes. The other one that we also have to address is a high cholesterol level. Okay. Now, having some understanding about whether there are any genetic factors that predispose you to having a cholesterol that is high is very, very important for you to know and have a discussion with your local general practitioner. But a cholesterol level being high can increase the risk. So again, it's an important risk factor for us to address in the context of all the other risk factors: hypertension, diabetes, cholesterol. Tobacco smoke is the other issue, and unfortunately, we are still confronted with smoking as an increasing risk in lifestyle behaviours, and that does prove to be quite challenging. But again, the benefits are significant in stopping smoking or reducing smoking has a significant impact on reducing the long-term risk of developing a cardiovascular event. And we'll have a separate video focused on smoking cessation. If that's a topic that you would like to see us discuss, please do make a comment and a suggestion on the bottom in the comment section. So we've talked about diabetes, high blood pressure, cholesterol, smoking, but of course being inactive can also be a major risk factor here. Being inactive leads us to a higher potential risk of body weight, and that body weight and increase in body fat accumulation can make us more vulnerable to developing other risk factors, such as diabetes. And it becomes a bit of a vicious cycle, unfortunately, with all these risk factors. With increasing body weight, as I said, we have a high incidence of diabetes. Increasing body weight means that the heart's having to work harder to supply more of the body, therefore increasing blood pressure as well. And that then has its own consequences. So again, today we've talked about the cardiovascular risk factors, separating them into the non-modifiable ones and the modifiable ones. Cardiovascular disease continues to be an ongoing challenge, unfortunately, in our community. Thereby, knowing what these risk factors are can really help us target them into the future and therefore reduce the risk long term. Thanks for joining me, and see you in the next episode.